During basic training, a doctor diagnosed me with complex regional pain syndrome. I have been in excruciating pain.
I have a couple of potential options. Before we can even go into those, one of the main concerns I have is you have a history of a couple of blood clots.
They found 6 or 7 small blood clots in my right lung and one bigger one that was blocking the airway.
I need to see 2 specialists.
Today what I'd like to do is to order a full, complete workup of your blood analysis to see if there's any underlying tendencies for you to develop blood clots spontaneously. I would also like to do a CAT scan of your chest.
We're going to do 3 tests for you today. The first one is an EKG, which shows the rhythm of your heart. Then we're going to do an ultrasound of your heart, otherwise known as an echocardiogram. And finally, we're going to do an ultrasound of the leg.
I haven't lost hope. There has to be an answer.
A routine exam to help a young woman with chronic pain uncovers an issue that certainly could threaten her life. Samantha joins us, as well as Dr. Timothy Davis and her mother, Kathy. Now, Dr. Davis, what do you think is going on?
You know, to understand complex regional pain syndrome, it's a short circuit of the nervous system. Certain nerve fibers start carrying pain signals that normally wouldn't carry pain signals. But one of the things with being immobile quite a lot, it's kind of hurting you. And so I know you're trying to get out there, you're trying to be involved in the gymnastics, but still spending a lot of time in bed, the wheelchair, you've been in the wheelchair for quite a long time, and then that kind of leads into the blood clots. So the more immobile you are, the more risk you have for the blood clots, and the worse it makes your situation, the complex regional pain syndrome.
So you were concerned initially with obviously her pain, but then you noticed her history of the blood clots. That allowed us to bring in some other members of the medical team to get this full evaluation. Now, cardiologist Dr. Marani was unable to join us, but he did inform us that after performing an ultrasound on Samantha's leg and an echocardiogram, that he thought her chest and heart were healthy and there were no issues with her leg that would keep her from being able to go forward with any treatment whatsoever. Now, radiologist Dr. Britt Somerville and hematologist Dr. Eli Gabayan join us right now. From a radiology perspective, you want to rule out any active blood clots or concerns, and what did we find in that evaluation?
So after doing a combination of CT scans and ultrasounds to look at the chest, the abdomen, pelvis, and her legs, I can safely say that I have no evidence that she has any active blood clots currently, which is excellent news.
Awesome. And Dr. Gabayan, with the history of having blood clots before, there's always this idea of maybe there's a deficiency or a genetic reason why she's having clots. What did you find with your testing?
We did find 2 different abnormalities, one called protein C deficiency and the other one called protein S deficiency.
So you have protein C and S deficiency, which makes you more likely to clot than the average person, but that's something that can be medically managed, and it's wonderful news to know that you have it, because
That's correct.
Dr. Davis, back to you.
There's numerous types of nerve blocks that can be done. I do believe that sympathetic ganglion blocks in succession, 1 week apart, a series of at least 4, can likely go ahead and start to curb this, but it's going to take consistency, right? And I'm willing and have pledged to go ahead and do that for you. It'll be no cost to you. So if you're game.
Absolutely.
All right.
Being able to have any sort of treatment options is exciting.
That's great.
Samantha and her mother will have to fly in from Reno for 4 treatments, so we reached out to Cabo, an innovative travel accessories company. We're actually joined by their founder and CEO, David Sternlight. David, thanks for being with us.
Samantha, we're really inspired by you and your story. On behalf of Cabo, we'd like to give you and your mother, Kathy, a check for $4,000 that will help cover your travel expenses to and from your appointment. Additionally, we have a couple of care packages for both of you that have some products that will hopefully make your travels a lot more comfortable. They include our Evolution pillow, our fold-and-go blanket, and our infused fluffy socks.
Thank you.
So Samantha, what I would say to you is never give up hope. You're in great hands. And this is one of those things where you've been through so much, but I truly believe you reached out to the show for a reason, and that you are on your way to feeling better. And I have to thank Dr. Davis and the entire team. Thank you so much for your help. And safe travels, Samantha, and thank you for sharing your story. Kathy, thank you as well. Let's see what's coming up next.
Coming up next.